signs of celiac. List at least three warning signs of celiac disease. Identify at least two foods that can trigger the symptoms of celiac disease. And name at least two risk factors for developing the disease. Celiac disease is a chronic genetic autoimmune disease. Once it is triggered in the body, someone will have it lifelong, and it is triggered by a genetic component. It is autoimmune, meaning that the body attacks itself. It is triggered by the consumption of a food protein known as gluten. What happens is that someone will consume a food or a food product that contains gluten, and gluten incites the immune system active, and it starts attacking the intestines. As you see in this photo here, side by side are two pictures of the small intestine, which is what is specifically attacked. On one side, you have these long finger-like extensions of the small intestine. They are known as the villi, and they are really tight, close together, and they help the body absorb what nutrients need to be absorbed and prevent anything from crossing out of the intestines that shouldn't be. As gluten causes this immune response, the immune system starts to attack specifically those finger-like projections called the villi, and they blunt or flatten and damage as shown in the opposite side picture. As far as the history of celiac disease, it is believed to have started developing as humans evolved with the first agricultural revolution. We didn't always have grains and cultivated livestock and farming, and as we did thousands and thousands of years ago, that consumption of gluten-containing grains was the trigger for this disease to become what it is now. Back in 2008, there was an archaeological dig in Italy that found a young woman age 18 to 20 back from the 1st century, and that in that archaeological dig, they were able to determine from her skeleton that she at that time was suffering from malnutrition as a result of celiac disease, and she was carrying one of the genes known for celiac disease. So it does go back quite a long way. While the first medical description was written back in the 2nd century, the first modern medical description of celiac disease was not formally introduced until 1887. This physician, Dr. Samuel Guy, proposed that celiac disease could be treated through diet. Unfortunately, he was not able to determine the specific food trigger. One of the diets he had patients working through was something called the Dutch mussel diet, but again, he wasn't able to find that specific trigger. In 1924, another popular diet, which is shown in that photo up in the corner, is the banana diet, Dr. Sidney Haas. This doctor took children who were malnourished, suffering from celiac disease, and brought them into their care. They removed all starches from their diet, things like breads, pasta, rice, and instead these children consumed many bananas, which is what brings the name banana diet. Now the children were able to improve nutritionally, their symptoms resolved, they were able to gain weight, but once the children left the physician's care, unfortunately, these symptoms returned because these children were then returned to their prior diets. In the 1940s, around the time of World War II, is when Dr. Willem Dick theorized that wheat was triggering celiac disease. In the Netherlands, there was a time during the Dutch famine, again during World War II, where individuals and families, they were not able to get bread because this food item had been removed from families' homes. This physician noticed that mortality rates, specifically of children suffering from celiac disease, decreased. And so he was able to realize that wheat was an important trigger when it came to celiac disease, but did not get the full scope of that gluten was the trigger. It wasn't until 1952 where findings came about where they realized it was not just wheat itself, but also other gluten-containing grains such as rye and barley. The first biopsy of the intestines wasn't done until 1956, where they were able to see the damage that was done to the small intestines from consuming gluten. And not until the 1970s were these specific genes established and that it was categorized as an autoimmune disease. Facts about celiac disease. It can develop at any age after the consumption of gluten. So it can affect anyone as young as 18 months old, all the way to our older adult population. However, average diagnosis is about 40 to 60 years old. It's an estimated that around 2 million people in the United States have celiac disease, and it afflicts about 1% of the world population. It is notable that in certain areas of the world, because there are not high frequency of the genes and these specific areas of the world do not consume a lot of gluten, they're not diagnosing celiac disease often, areas such as the sub-Saharan Africa, as well as Japan. The tricky thing with celiac disease, which we'll go into more in depth, is that there is such a great range of symptoms that about 80% of individuals with celiac disease are either undiagnosed or misdiagnosed with another condition. It's more common among white Americans, as well as biological females, up to 60 to 70%. And that's actually a common thread among autoimmune diseases in general. Typically afflicts biological females over males. Diseases associated with celiac disease, because it is an autoimmune disorder, and with any autoimmune disorders, you are more likely to be diagnosed with more once you're diagnosed with one. There are many autoimmune disorders associated with celiac disease, such as type 1 diabetes, thyroid disease like Hashimoto's, Graves' disease, and Addison's disease. There's a disorder called immunoglobulin IgA deficiency, which means your body's not making enough of this important immune response, IgA. Also, rheumatic diseases like rheumatoid arthritis, lupus, Sjogren's, and liver diseases such as autoimmune hepatitis. It's also more common in individuals with certain chromosomal disorders, such as Down syndrome, Turner syndrome, and Williams syndrome. What causes celiac disease? As I've mentioned a few times, one of the biggest components of celiac disease is the component of the gene. There are two genes that signify celiac disease, HLA-DQ2 or HLA-DQ8. It is important to note that if you do not have the gene, it is very, very unlikely, albeit most of the research I have said is impossible, to develop celiac disease. Of note, up to 30% of individuals can carry these genes, but only 3% of the people carrying the genes actually develop celiac disease. If you have the gene and then you consume gluten, then you are more likely to possibly be at risk for developing celiac disease. What is gluten? We hear gluten a lot these days. It's becoming more prevalent and known about, especially in our grocery stores, social media, everywhere. So what is it? It is a cohesive elastic protein. It's actually a protein made of two other proteins known as gliadin and gluten. It's naturally occurring in gluten-containing grains such as wheat, barley, rye, spelt, kamut, and triticale. Anything that contains wheat flour or flours from these grains would also contain gluten. It's also in foods, ingredients, non-food products such as bread, pasta, cookies and cakes. Again, anything made from wheat flour. It's in malt, which is an additive made from barley. It could be in food starch, which is made from wheat. And other non-food items such as lip balms, lipsticks, toothpaste, Play-Doh, and we'll certainly go into more detail as we move through the presentation. But it's just to say it's in a lot of foods as well as non-food products. Lastly, there are a number of other factors when it comes to celiac disease, which is also true for most autoimmune diseases. We have the gene, we have the trigger of gluten consumption, but there's a lot of other research ongoing as to whether more infections early on in life, specifically ones that affect the gastrointestinal tract, does that put someone at risk for developing celiac disease? Additionally, there's research ongoing questioning as to whether, with these infections, whether they're digestive or not, if someone is on more courses of antibiotics early in the course of the life, could that cause changes to the microbiome, and could that be associated with celiac disease? Research is showing it could be associated, but there is no causation, but it is important to keep in mind. I'm not going to go too in detail with this photo, but I think it's just a great snapshot to see how detailed the immune system is as far as how the breakdown of gluten happens and how it affects your immune system and your small intestines. So as we talked about before, our small intestine is made up of these finger-like productions called the villi. They help, again, to absorb your nutrients. With gluten, when someone has celiac disease, someone consumes a food or food product containing gluten, and it causes this immune response. What I love about this picture, it shows how there's all of these different steps of the immune system, and ultimately, and very sadly and unfortunately, it damages these villi. With these villi being as damaged as they are, the body is not able to absorb nutrients, which is why there is such a plethora of symptoms and signs, some which are more obvious than others. So the most commonly known symptoms of celiac disease are related to your gastrointestinal system. Abdominal pain, abdominal distension, also known as bloating. Someone might describe it as feeling like they are pregnant. It is that severe of a bloating. Constipation, diarrhea, gas, lactose intolerance, nausea, vomiting, and weight loss. It's important to note that children more significantly have malabsorption issues like weight loss and diarrhea, but adults can experience it as well. Moreover, though, with adults, it's with the gastrointestinal symptoms are more related to something called IBS or irritable bowel symptoms. So yes, bloating, constipation, discomfort, lactose intolerance, but nothing as severe as the malabsorption that children might experience. With lactose intolerance, that occurs because the damage to, again, those villi, those finger-like productions of the small intestines, affects your body's ability to break down and absorb lactose in dairy-containing foods. The fortunate thing is, as someone begins to follow a gluten-free diet and as someone begins to heal, more often than not, an individual, once they are healed and in remission, can consume dairy products once again. Non-gastrointestinal related symptoms. A lot of these symptoms are what an adult might experience in addition to some gastrointestinal symptoms, but this is why celiac disease can be underdiagnosed and misdiagnosed, because it looks like so many other diseases and disorders out there. So cognitive impairment, which also might be deemed as brain fog, difficulty concentrating, depression, anxiety. Certainly there is effects to the reproductive system, whether it's infertility, early menopause, fatigue, headaches, and migraines. Iron deficiency anemia affects up to 40% of those diagnosed. And that symptoms very similar as well: headache, fatigue. You also might experience shortness of breath and dizziness, cold hands, cold feet. With iron deficiency anemia, you might have a desire to eat non-food items like ice, dirt, or clay. On the second half of the presentation, we have this rash called dermatitis herpetiformis. It is linked with celiac disease, although not every person who has celiac disease does have the rash, but it can occur. Again, things like joint pain, mood changes, mouth ulcers or sores. 70% may have changes to their bone with osteoporosis or osteomalacia, so a softening of the bone, as well as neuropathy, maybe some tingling in the hands and feet, and the spleen is not functioning as well. So I won't go through everything on this side, but again, just to show the wide range of symptoms someone can experience, specifically children as well. Again, more often with children, they're experiencing malabsorptive symptoms, chronic diarrhea, failure. They may be diagnosed with something known as failure to thrive, so they're not growing appropriately, weight loss, loss of appetite. Those are significant signs in children. When it comes to the types of celiac disease, it revolves around the symptoms. So the classical type, again, those signs and symptoms of malabsorption, which is usually seen in adults, usually seen in children. About 27% of adults may experience that. More often than not, they are following along the symptoms of a non-classical type of celiac disease. They may be experiencing some discomfort gastrointestinally, but again, these strange symptoms like headaches, joint pain, that might seemingly be coming from somewhere else. Now, notably, silent or subclinical celiac disease. This is someone who is asymptomatic, not having any symptoms whatsoever, but their intestines are becoming damaged after consuming gluten. And it is up to 21% of the adult population are not having any symptoms, which again is why so many individuals are not diagnosed or misdiagnosed. Now, upon diagnosis, you'd be working with a physician, most likely a gastroenterologist. They would go over any conditions associated with celiac disease, which would be your number one risk factor. Again, things like type 1 diabetes, autoimmune thyroid disease, rheumatoid arthritis. Any autoimmune diseases are closely linked with having a second one and a third one diagnosed over time, unfortunately. Secondly, would be those chromosomal disorders. Your second risk factor would be if you have a first-degree relative with celiac disease. A first-degree relative, you have now a 1 in 10 risk of developing celiac disease. So it is important, if you know someone in your family, brother, sister, father, mother, that is diagnosed, it is recommended that everyone in the family get tested as well. A doctor will assess your symptoms, again, ranging from gastrointestinal symptoms, non-gastrointestinal symptoms, performing a physical exam, also integral, looking at, is there any abdominal discomfort, bloating? They might also assess for different vitamin deficiencies like iron deficiency anemia, looking at your nails, seeing if they're brittle, which is another sign of that anemia, looking for the rash. And lastly, screening is not routine in the United States. Where a doctor may screen for celiac disease is pertaining to the risk factors. Do you have a condition associated with celiac disease, and or do you have a family member who has celiac disease, but oftentimes there is no official screening. Furthermore, diagnosis goes on to incorporate a lot of testing. So there is blood work with the immune response from consuming gluten. Your body will produce a lot of different antibodies. So there are many different tests that will look at specific antibodies or antigens and to see what your body is producing in response to consuming gluten. If it's over a certain threshold, that is one step closer to being diagnosed with celiac disease. You'll also have blood work to look at, again, if iron deficiency anemia is present or if there are any other vitamin deficiencies. The true gold standard when it comes to testing is an endoscopy, where a gastroenterologist takes a scope. Normally, the patient is under anesthesia, and they will take a scope and take different biopsies of your small intestines, as well as look around to see if there's been any intestinal damage. And that truly is the gold standard. Lastly is genetic testing. That's not something that is done necessarily because, as I said earlier, only 3% of the population, or up to 3% of the population can with the gene can have celiac disease, but there's only 30% there's up to 30% of that population that can have the gene, and so many cannot develop it. So it can be helpful. Let's say someone is really sick and they've already started going gluten-free. In order to see if someone has the gene, they might do that test just as a way to rule it out. However, if someone, again, has the gene, they still have to verify with antibody testing. And the gold standard are endoscopy. Now, I just talked about someone going gluten-free prior to testing, and that actually is not the recommendation. It is advised to continue consuming gluten until your testing has been completed. If you have been on a gluten-free diet for some time, you do need to consume gluten, 3 to 10 grams of gluten per day for up to 6 to 8 weeks in order to get an accurate result and an accurate diagnosis. Typically, physicians will look at the 4 out of 5 rule, which is what they look at for diagnosis. Are there antibodies present? Are you having signs and symptoms of celiac disease? Has there been genetic testing? Number 4 would be that biopsy. And number 5 would be if someone's already been on a gluten-free diet, how are they responding? So 4 out of 5 is what is usually the rule when it comes to diagnosing. The exemptions would be right there on the bottom, potential celiac disease and something called seronegative celiac disease, which is 2 to 3% of the diagnosed people with celiac disease. Potential celiac disease, someone may have positive antibodies, but they may not have any damage or any symptoms. If that's the case, if it's just that the antibodies are elevated, someone can still consume gluten. They just need to continue to follow up with a doctor regularly to make sure that that damage hasn't started with the intestines. With seronegative celiac disease, that is when you're not producing any antibodies, but there is significant damage and there are significant symptoms. So someone would have to follow a gluten-free diet. The treatment for celiac disease is a lifelong adherence to a strict gluten-free diet. Unfortunately, that is the only treatment at this time. Additional treatments, which are important, if there are any vitamin or mineral deficiencies upon testing, you will supplement until resolved. With the skin rash that I mentioned, dermatitis herpetiformis, that usually can resolve within a year or two of following a gluten-free diet. If it doesn't, there are medications a doctor may prescribe. If there is osteoporosis, if your bone density is decreasing, they may look for a bone density scan, which is another treatment, a diagnostic treatment. And then again, you may have to resolve that with supplementation over time. What is great news is that starting and maintaining a gluten-free diet will help resolve symptoms, it will prevent complications, and it could and should improve some of the associated diseases with celiac disease. Disappearance or significant decrease in antibodies and regrowth of those finger-like projections, those villi, typically occurs within 12 months, and oftentimes someone will start feeling better within days to weeks of making changes. As I mentioned, as you are diagnosed with one autoimmune disorder, it is common to be diagnosed with more over time. So as you are diagnosed earlier in age with celiac disease, it lowers the chance of developing another autoimmune disease. However, if you are diagnosed later in life, you have a much higher chance in developing another autoimmune disease later on. Now, when it comes to following a gluten-free diet, let's talk about all of the foods that contain gluten that you must avoid. Things like wheat, wheat berries, durum, semolina, which are in pasta, farina, farro, graham and graham crackers, rye and rye bread, barley, malt. Malt comes from barley, and it is a food product used in lots of things such as milk and milkshakes. It's used in syrups and vinegars. That's a tricky ingredient always to look for when you're reading food labels. Brewer's yeast, which is used in making bread and beer, and something called wheat starch. Just because starch is derived from wheat does not mean that it contains gluten or gluten-free. It depends on how it is processed, which we'll go into in a little bit. Common foods that are high in gluten, anything that comes from wheat flour. Pasta, any type of noodles, aside from, a specific rice noodle, a rice noodle would be gluten-free. Baked goods made with wheat flour, crackers, pretzels, bread, pastries. It is a large group of foods that you do have to eliminate when you have to follow a gluten-free diet. Other things like cereal and granola, foods that might seem gluten-free like cornflakes and Rice Puffs, Rice Krispies, often contain that malt flavoring, that malt syrup as a sweetener. Granola often is made with regular oats versus gluten-free oats, which I will dive into a little bit deeper. Your typical breakfast foods that are made with flour, any type of breadcrumbs, croutons. Sauces and gravies often use wheat flour as a thickener. Traditional soy sauce is made with wheat, flour tortillas, beer, and any type of malt beverages like wine coolers. Foods that may contain gluten. So we have our definites and we have ones that may contain gluten, which again makes this diet on the trickier side of things. So energy bars and granola bars may have oats, things like French fries, potato chips might again have ingredients that contain gluten, or if you're getting French fries out to eat, if French fries are fried, well, they're from potatoes, which are gluten-free. If they are fried in a fryer, that also fries something like chicken fingers that would be breaded with flour. The French fries are no longer gluten-free. Although some French fries do come with a coating that contain wheat as well. Nut mixes, flavored coffees and teas, candy bars often is that malt flavoring. That's a sneaky one in there, whereas something may not have wheat, but it will have that malt flavoring. Certain types of chips that are multigrain, whereas a typical corn tortilla chip would be gluten-free for the most part. Any type of multigrain chip may have other types of wheat and whole grain products. Imitation crab, meat substitutes that might be vegetarian. There's so many out there these days because they also contain wheat products often. I mentioned soy and teriyaki sauce, deli meats, any kind of filling, even if it was not in a cheesecake, but a cheesecake filling in and of itself might have some flour that's mixed in to stabilize. One that is not often realized is eggs that are served in restaurants like an IHOP. They often take some of their pancake batter and mix it into the eggs for their omelets. Most alcoholic beverages and most vinegars are gluten-free, and that's just straight alcohol. Most wines are also gluten-free as well. With the distillation process, that gluten molecule, it's too large to carry over. Now, dessert wines or malt beverages may have color or flavoring that contain gluten. Cocktail mixers may contain gluten. If you're ever in doubt, it's always good to contact the companies. Now, specifically, any beer, ale, lagers, malt beverages, and malt vinegars, they are not gluten-free. They contain gluten-containing grains. Other items that might contain gluten, any cosmetic used by the mouth, you want to ensure that it does not contain gluten. Oral care and dental care products, communion wafers. I know specifically in some denominations of the Christian faith, they are producing low gluten hosts, which are appropriate, but most communion wafers are not appropriate. Any type of herbal or nutritional supplement, it's important to make sure that is gluten-free. In addition to drugs, medications, whether over the counter or prescription, the tricky thing about food and supplements compared to medications, with food and supplements, they are regulated to disclose certain things. Medications don't have the same laws. So medications are not required to disclose whether they contain gluten. And one brand versus a generic brand, the binders are what might contain gluten, and that might be different from a Tylenol to the generic brand of Tylenol. I'm just using that as an example, but medications are something to review often as well. Play-Doh, although we're not eating Play-Doh, if you have young children or if children are diagnosed with celiac disease, Play-Doh does contain gluten, and if it's worked through on the hands, it may not be washed off enough prior to eating. I know there are recipes out there to make your own, and there may also be different ones you can find out on the market as well that are gluten-free. Similarly, along that lines, lotion, shampoos, things that might go on the skin are typically fine. Gluten cannot pass through the skin barrier. So it's okay if a lotion or a soap contains gluten, but if you're using something and not washing your hands, sunscreen along those lines as well, like the Play-Doh, may be a concern. Now we come to our naturally gluten-free foods. So what you can include in your diet: fresh fruits, fresh vegetables, plain meat and poultry. If it's processed, like sausage or bacon, you do want to look for the gluten in that. With plain fish and seafood, it's also appropriate. What I would encourage looking for there is if you go to the fish counter and a plain raw salmon is next to maybe foods that have been breaded, that's a place to be mindful of. Dairy is typically gluten-free. However, if it's something like a yogurt and there's any mix-ins, or cheese might have other binders, preservatives, those are places to look for. Similarly with beans and nuts, beans and lentils specifically can be processed along the lines with gluten-containing grains, so that while on their own they're gluten-free, they might be come into cross-contact. On that other side of the list are your gluten-free grains. Lots of options, or gluten-free grains and starches. Lots of options. The concern here would be if they come into contact with gluten-containing grains. So if you're purchasing these items, you always want to make sure that you purchase a gluten-free variety. With oats specifically, as well. It should be gluten-free oats. Now, there is a small subset of the celiac disease population that do have a response to oats. It's to the protein known as avenin. What researchers have shown is that even if someone with celiac disease has symptoms and a slight immune response to consuming gluten-free oats, they are still safe to consume, and they're not promoting any damage. There's no damage to the intestine. So as of now, research has shown that they are safe as long as they are certified gluten-free. And coming to that term, certified gluten-free, what does that mean? That means that there is less than 20 parts per million of gluten in a food product. So it doesn't have any of those grains. It does not have those ingredients derived from grains. And if it does, it's less than 20 parts per million. And what that means, as you see in the photo with the sand, we have 1 million pieces of sand, 20 pieces of sand, very, very small amount. There's also the concept of looking at a bag of marbles. You have a large bag of marbles, 1 million of them, 999,980 are blue, gluten-free, and those 20 red marbles are that 20 parts per million. That would be where you want to stay under the gluten threshold. They did a study to determine this fact. It was determined that 10 milligrams of gluten per day was the threshold for causing damage in the small intestines with adults with celiac disease. That could be just a crumb of bread. A very small amount can cause damage. Now, why aren't our foods and food products required to be completely gluten-free, zero? For a few reasons. One is they've determined that under that threshold is perfectly safe. Most testing abilities, they cannot test for 0 parts per million of gluten. It's just not possible. Even if it was possible for testing, it would make it very hard for our food system to produce appropriate food products. And lastly, I'm sorry, I lost my train of thought there for a second. So we have our food products, it's not possible. And yeah, I'm sorry, I lost my last train of thought there. But anyway, it's perfectly safe to have up to 20 parts per million in your food product. And oh, this is what I was going to say, is that even though you're allowed up to 20 parts per million as a food company, that most food companies are testing much, much lower than that, about 3 to 5 parts per million. So it's safe under that 10 milligrams, that 20 parts per million, but these food products test much lower. Now, when you're looking at food labels, on that one side are a variety of different gluten-free symbols that are on various food products. It's important to know that these labels are voluntary. So, but in order to qualify for that label, these foods have to contain less than 20 parts per million. Now, when it comes to what has to be labeled, allergens have to be labeled. So a food product might say contain wheat, because wheat is one of the top 9 allergens. If it contains wheat, it would definitely contain gluten. If a product doesn't contain wheat, but it does not have the gluten-free symbol, it could still have enough gluten to make someone sick. Now, if something is labeled gluten-free, but manufactured in a facility that also produces wheat, that manufacturing plant is taking steps to prevent greater than 20 parts per million. So if it says it's manufactured in a facility that produces wheat or processes wheat, but it's also gluten-free, that is appropriate to consume. Cross-contact is an important aspect, which I've kind of touched on throughout the presentation. It's when a gluten-free food or a food product is exposed to a gluten-containing ingredient or food, making it unsafe for people with celiac disease to eat. There's a risk of cross-contact in the kitchen, but also during processes like growing, processing, and manufacturing. As I touched on with items like the gluten-free grains, beans, lentils, etc. Now, in your kitchen at home, places gluten can hide. Your toaster. Toaster is something that you do not share with someone that is putting gluten-free or gluten-containing food in it. Convection ovens. Convection ovens circulate the air, so it moves those gluten particles around. So ideally, that's not something to share as well. A plain oven, a standard oven is fine. Covering if you have gluten-containing foods and gluten-free foods in it, that's fine. Just try to stack the gluten-free foods on top and cover them, and then the gluten-containing foods on the bottom. You don't want to share sponges, dish rags, no sharing of condiments. So if someone uses peanut butter for a wheat slice of bread and use that same peanut butter that someone else used, that would be a risk of cross-contact. Boiling water for pasta, which is what a lot of restaurants do. They might just boil one pot of water and put all the pasta in. Frying oil, if you go to a restaurant and want French fries, you should be going to a restaurant that has a dedicated fryer. Cutting boards, grills or griddles, handles, the pantry. If you're in a house that has, again, gluten-containing foods and gluten-free foods, similar to the oven, you want to try to put the gluten-free foods on top and the gluten-containing foods on the bottom. If it was the reverse, any of those gluten-containing foods, if there's any crumbs, they might trickle down. And airborne flour. So if there's a lot of baking, airborne flour would also be a concern. With dining out, it does have the potential to experience cross-contact. It's important to look at the menu, call ahead, see if they have a gluten-free menu or gluten-free options, and ask them how to prevent cross-contact. The best time to call is when they're not busy, so maybe in the morning or in the middle of the afternoon. Best case scenario, having a separate prep space, cookware, utensils, making sure there is no risk for airborne flour in the kitchen or cross-contact on surfaces. Some restaurants nowadays when they bring out your meal, it might have a little flag or a little toothpick or an indicator that it's a gluten-free meal. And best case scenario, if you have a good experience, it's always good to thank you and follow up. Included 2 apps on here, Find Me Gluten Free and the Gluten Dude app, which you are able to look up in various areas of the United States, restaurants and individuals' recommendations, whether they did get sick, they didn't get sick, any of these things, whether they have separate kitchen space, maybe they're even 100% gluten-free. But you can always go back on these apps and write a nice review or write a nice review online if you have a good experience. When it comes to celiac disease and the gluten-free diet, it is not the same as something like non-celiac gluten sensitivity. When you're diagnosed with non-celiac gluten sensitivity, you do not have an immune response, although you might have similar symptoms like gas, bloating, constipation. There is no damage to the small intestine, but a gluten-free diet is recommended just to feel better. A wheat allergy, there is an immune response, but it's very different. You might have hives, shortness of breath, anaphylaxis. There is no damage to the small intestines, although you might have some gastrointestinal symptoms as well. And the biggest caveat is that there are gluten-containing foods that are wheat-free. So if someone has a wheat allergy, they still might be able to consume gluten-containing foods. So this is a great picture of what it can look like for someone with celiac disease when it comes to eating on a regular basis, having to prepare their foods, when it comes to food shopping, if they're living in a home with gluten-containing foods as well, dining out, does it affect their social life at work? It affects a lot of people's lives in a lot of different ways, even when starting to feel better and following a gluten-free diet, because it is the only treatment at this time. If celiac disease goes untreated, most of the long-term effects relate back to the symptoms. Osteoporosis, vitamin and mineral deficiencies, infertility, miscarriages, Sadly, there is a risk of cancer if it is not treated appropriately. 2 times greater risk of developing coronary artery disease, as well as a 4 times greater risk for developing small bowel cancers. Non-responsive celiac disease is when someone's been following a gluten-free diet for up to 12 months, but they have persistent symptoms, antibodies, and damage to the intestines. It's common in adults and children, and up to 30% of patients may experience this. More often than not, it's one of 3 things. It could be a condition unrelated to celiac disease. If you are dealing with a condition unrelated to celiac disease or you're having continued symptoms, you do want to follow up with your care provider if they need to diagnose and treat something else. At that bottom there, the cow's milk protein allergy, they're finding that in children who are diagnosed with celiac disease and they're not responding, it's more than just lactose intolerance, but they actually have an allergy to cow's milk protein. If it's not a condition unrelated to celiac disease, it could be ongoing active celiac disease. It could be that with all of these small places that gluten can hide, that you're continuing to be exposed to gluten, or it could just be that you need a longer time to heal. Usually up to 1 year, you should be healed, but it could take up to 2 years. Lastly, something called refractory celiac disease, which is when, again, you're persisting with symptoms, damage to the small intestines, and independent of following a very strict gluten-free diet, excuse me, you have this abnormal population of white blood cells you're producing. There are 2 different types, not very common. 1 in 100 celiac disease patients have type 1, 1 in 200 have type 2. There is a very high chance of intestinal lymphoma or cancer. It often occurs in only 1 to 2% of individuals with celiac disease, often older adults who are diagnosed later in life. They may not be following a gluten-free diet, or they might just not be following it as strictly or correctly. But it is very rare. The most recent research as far as celiac disease, while there are no medications yet, there are promising clinical treatments. Medications are working at targeting the immune response. So if someone consumes gluten, it's all of those individual pathways we saw in that photo back in the beginning of the slides, targeting how the immune system responds. There are preventative or therapeutic vaccines. So if someone's at risk, but they have not developed the disease at this time, a preventative vaccine may be appropriate. Therapeutic, if they have developed it, but they're able to mitigate the symptoms and the intestinal damage. Lastly, they're working on medications to break down the actual gluten using different enzymes so that the immune system wouldn't respond. Here are my references, and thank you very much.
Thank you for joining us today. We appreciate your participation and feedback. If everybody would take a few minutes to fill out today's program survey, which I have put into the chat area. And this concludes our webinar. Everyone have a great day and a great weekend. Thank you.
Thank you, Trixie.